Welcome to Share, a podcast production of Amethyst Recovery Centers. I'm your host, Kabir. At the top of each show, we'd like to remind our listeners that addiction is treatable and recovery is possible. To seek help for substance abuse use disorder, call 855-80-SOBER or visit us at amethystrecoverycenters.com today. Today's show is a little different from most of our recovery-related topics we've discussed before. We're joined by Dan Gemp. He's the CEO of Dreamscape. It's a digital marketing company whose clients are all in the healthcare space, but as I understand it, the largest in the particular treatment center space across the country. Dan will be the first to tell you that throughout his years, there have been some kind of shady practices when it comes to online marketing for treatment centers. And he's here to talk about ethical marketing and the dangers of patient brokering. Dan, welcome to Share. We're glad to have you here.
Thanks so much for having me, Kabir. I appreciate it. And I've got some important information to share today, I think.
Yeah, I'm excited to dive into that. There's a lot of misinformation out there. Personally for me, I've heard about a lot of different, quite frankly, horror stories in treatment, especially in particular areas of the country where kind of treatment proliferated for a period of time, and there were some bad actors. But we'll sort of all get to all that. So a lot of our guests are not in recovery. I don't know if I shared this with you, Dan. I happen to be a person in recovery. Our listeners know that I am also a person in recovery, but you're not. But that doesn't necessarily disqualify you for being an expert about aspects of recovery or in treatment. But your marketing groups, while they deal strictly with the healthcare space, as I understand it, we're going to focus on the subset with his treatment centers, and tell us how that came about.
Sure. So we've been around for about 15 years, and for about 13 of those years, we have specialized in addiction treatment. I've grown very passionate about the space. Last year, we helped about 15,000 people get into treatment programs through our clients' own websites. That's a big deal for us. Transparency and that mission focus. It came about somewhat randomly. There was this large migration away from the old school media, the yellow pages and the online directories, into what is now modern search engine optimization and huge expenditure on Google pay-per-click ads. And so as we got into the space, a lot of our partners were referred into us by media groups we worked with and other medical services clients. And it turns out that we had the right recipe, right? We were really big on ethics and transparency at a time when the industry was lacking that. And we had scalability that a lot of groups in the space, a 4-person, 5-person team isn't going to be able to hit the same audience that we'd be able to with a more expansive team.
So, and you mentioned something about SEO, search engine optimization, for real quickly, for perhaps a listener that doesn't understand what that is. Could you just describe what search engine optimization is?
Sure. So on a treatment center's website, someone has to write that content. They have to inform you about the programs and services available, information about medical licenses, about the executive team. And so we produce all of that content, but there are technical best practices that help that content to rank higher on Google search results and Bing and other search engines. And so we deploy both. We produce content on behalf of treatment centers along with their brand standards and clinical programs. And then we optimize that content so it ranks higher in search results and gets directly to consumers that are searching for care for themselves or a loved one.
And there's seemingly nothing unethical about that. It's a way of marketing.
It's actually, we do everything. It's called white hat. Black hat would be more of like a hacker approach. It's important that we stick to our standards on this because there are so many unethical marketers in the space. There's a lot of scammy behavior going on. All we do is produce content branded for a treatment center on their own website, and all interaction and all dialogue happens through a treatment center's own website directly.
Got it. And so the dominant force, and I'm no expert on the internet, I'm sort of guessing that Google's the dominant force, right? They've captured most of the internet traffic. But what I do know about Google is they kind of put their foot down in sort of 2017.
Oh yeah.
And yeah, so tell us a little bit more about that, because I understand it locked up almost entirely, and then it opened up over a period of time.
Yeah, and we were a big part of that. In 1 year, we filed over 300 complaints. We're a Google Partners premier agency. We actually ended up hiring our director of paid search from Google. He's the guy that they would send out to their TED Talks and industry conferences and such as a thought leader. But it turns out he's got family members in recovery and is very passionate about the space. So he joined us. But what was happening is people were running, there's normal competitive practices like trying to bid on another treatment center's name, right? So when someone Googles them, your treatment center shows up. But this went way beyond that. Groups were stealing, they were using the suggest and edit feature on Google My Business, and they were stealing the phone number of other treatment centers on their own listing and having it go to them. And on paid ads, there were essentially fake treatment centers, right, setting up real websites to generate leads. And they were patient brokering. They were selling patient placements for thousands of dollars per patient to shady treatment centers. And that evolved into, there were placement services and hotlines. It was all pay per call, but really it was pay per lead, and really it was pay per admission. And so, even in some states, they've had contract marketers where you pay a 1099 employee to essentially pretend to be a salesperson, and they're just patient brokering from other treatment centers and getting financial kickbacks. In any other medical sector, there would be outrage. This would, disgust the public, and there would be uproar. But this is so stigmatized as an industry. Addiction treatment is such a sensitive topic, and families don't really go out and fight that battle, because then they would have to be publicly declaring that they or a loved one are in recovery. And that should be a bold, ethical thing to do, right? Pay it forward and help others. But it's such a sensitive topic and so stigmatized. That's what led to this, right? And so the bad actors took advantage of that silence, and they spent millions of dollars on paid ads, abusing Google's bylaws. Google was not complicit in this. They're completely against it. And so they actually shut down their entire ad platform to the industry on a purely ethical stance for over a year, about 14 months. And then when it came back, you now have to go through a company called LegitScript to get a background check, to check your medical licenses, your NPI numbers, your physical addresses. They need to see signage of your logo on your building in your Google My Business profile. And so they go through this confirmation process now to at least verify that you are a real treatment center providing real medical services. And I just want everyone to realize, like, at scale, ballpark, several $100 million was the loss to Google to accomplish this. So they took a hit to help advertise and become more ethical and accurate. They took about a $300 to $400 million hit, from what I can tell, to reposition this and better serve the marketplace. But it's been a battle. We've been fighting this on a lot of fronts for years.
And was the main driving force behind that to thwart patient brokering? Could you tell the listener, like, exactly what is patient brokering, right? So a brokering context, and I get a mortgage broker. I like the guy who's going to help me get a real good rate.
So imagine any medical condition, right? A chronic condition, diabetes, a recurring form of cancer, anything like that. If you went to the nation's leading expert, right? So you're looking for a brain surgeon here, and they say, I'm busy, but I'm going to refer you to my buddy Steve. If it's a medical referral based on their assessment of your healthcare and your needs, then wonderful. That's how our system is built to work. But if that neurosurgeon refers you to Steve, who's a dangerous, less quality service provider, right? And he's getting paid for it. He's getting $5,000 every time he refers a patient to Steve. That is corrupt. And we see other similar, behavior in other industries, in cosmetic surgery, right? The refer a friend kind of structure. In senior care, there are placement services that are viewed as a real estate transaction, but in my opinion, they're selling grandmothers, And so that concept of being, admitted to a hospital for acute medical care, right? For a chronic condition, only because somebody was paid to put you there, That's the problem. And if you receive care that isn't right for your circumstances, the outcome is still relapse, recidivism, overdose, death. So it's more than just a moral scruple. It's a crime. First of all, it's an actual crime, and it's paying for patients, and you do not want to be the victim of that.
Right. And lately, the term patient brokering has been thrown around a lot. And my understanding is there was a particular time, maybe a dozen years ago, decade ago, where it didn't look like it looks today. Perhaps there was. I guess I take my own personal experience. When I got out of the University of Maryland, I won't share what year and date myself, but I entered. We sold Microsoft systems engineers programs and Novell and things like that. And I had a base salary and every package that I sold. Somewhere along the line, it got out of hand, I guess.
Yeah, and I can comment on that. So my understanding, Kabir, is this, that for a while you would have, an outreach representative or an admissions expert from one treatment center who had a standing referral relationship with another treatment center. And let's say that one provides residential detox, which is medically necessary for alcohol and opiate treatment, right? And let's say the other one is simply a residential or an intensive outpatient program, and they don't have detox. It does make sense medically for the outpatient center to refer that patient to detox and stabilization first. That's a medical referral. And so in this industry, it did start out like that, where a patient was referred on their actual medical needs to a complementary service provider, and then they would be referred back to that original source for ongoing care. That
if I may just interject on that one thing.
Sure.
So there's nothing wrong with that. Hey, whenever my clients, patients, whatever I choose to call them, need medical detox, I'm going to send them to you.
Right. That's normal. Hospitals do that. That's extremely normal. Your physician would probably have a preferred, wrist surgeon if you ever required that. Right.
Right.
Specialists. And so it does make sense for medical experts to have a network of specialists that they partner with. It's complementary. If they were selling you,
right,
that's a highly different issue.
Right.
And so that is the difference. That it began, from a medical utilization review perspective, that, this patient needs stabilization in a detox center, in a hospital, essentially, right? And then they can come to us for a month or two of care. That makes more sense medically. But to say they need to go to detox because I'm going to get $5,000, that's a crime.
So would you then say that the treatment industry is particularly vulnerable to these kind of unethical, marketing, if you will? It seems like that it's very pronounced. And as a person in recovery myself, we can often get stigmatized and labeled as he or she's uneducated. They lack the life experience or whatever it is, versus a medical professional goes through a lot of school, right? There's a lot in front loaded there in order to get to that finish line. But I sort of wonder what that looks like, or what you've seen from.
Yeah, it really is predatory, just outright, right? You're taking someone literally for someone to pursue treatment, right? They have to hit at least a semblance of rock bottom. So you are directly taking advantage, predatory, of someone that is in true need, and the outcomes are prison or death. So that's about as low as it gets. What is unique to the treatment space, the reason this became such a pronounced problem, there are large payouts for addiction treatment. It can cost $30,000 a month for private care. Good insurance policies will pay for that. And so it's a high financial return. And a lot of the groups in the space are very well funded, right, by an absentee owner who doesn't realize what's going on. So a lot of this is, large marketing budgets, an absentee investor, people just trying to hit goals or quotas. They get desperate, and that's what happens as an outcome. So really, it's something to look inward on, to check your organization and make sure that you're not incentivizing your team members to do this. check your media budgets and make sure that it is direct phone calls that you're generating, through a directory, for example, to your own treatment center, and not just a generic, hotline where no one really knows who they're calling.
I think part of it is as well, and thanks for all that's some really good guidance. Is that my understanding? There's still even some states out there that don't. Let's just talk about a particular, a true outpatient. There's no licensing. It's sort of, I hate to put it like this, pay and play. You can, if you got the money, like you mentioned, the funding to open it up, get a space, the
barrier to entry is low, right? It's an attainable model, or even to open a psych practice is actually not that difficult as long as you have a doctor. Right. And we've seen, mental health is off the charts. We're at an all-time high level of inquiries for both primary mental health issues and primary substance abuse diagnoses. And we track all that. We're tracking call volumes and which keywords are getting these clicks. And it's, yes, it's easy to open these programs, and states wouldn't fight it because, it's an epidemic level of mental health disease, right? And so we need more beds, we need more treatment, they need more experts. So why would a state fight that? But yeah, some of these places where it's easier, or there's a certain bed count, you can open a 6-bed or a 12-bed place without much trouble. That is an issue that can cause some of this. And then groups think that it's easy to drive those admissions. Well, it's not easy. You have to have an outreach team, an admissions director, someone to pick up the phone 24/7. Like, there's infrastructure required that a lot of groups don't have in the beginning. And that can also lead to some desperate behavior.
Right. The pandemic that we find ourselves in,
yes.
it did do, you're obviously in this space, you're highly data driven, you're capturing that data, you're analyzing that data, everything that goes along with it. Is the mental health you described, or the inquiries therefore, what they're with rather, is there a correlation between the pandemic and
massive correlation? Yeah. Okay. And in this case, it's both correlation and causation, right? There's the old joke about correlation that because ice cream sales and shark attacks both spike in the summertime, that ice cream causes shark attacks, right? In this case, the isolation of lockdowns during COVID, the employment-related issues during COVID, right? They hit the population hard. And so we've seen about a 15% increase in first-time mental health primary diagnoses. And I would expect that to continue climbing. College students haven't all gone back to college yet. We're seeing a lot of issues there. The data that we monitor, like self-harm statistics, female suicide by firearm, I mean, that's how you see how a society is doing. And those stats are up, and society is not doing well. The CDC came out with 2020 stats. Overdose deaths increased massively by about 10,000 just in 2020. So what's happening is both huge increase in first-time diagnoses, right? Stressed out executives working remote, drinking because they don't have to go to the office. That all exacerbates. Pair that with, job loss. Getting a $1,200 check in the mail is a very dangerous thing for an addict. And so people don't realize, like, that's a nice stash of heroin, but oftentimes an addict won't pace themselves when they get their hands on $1,200 worth of heroin. And so this does correlate, if not directly impact, overdose, mental health. Now, to combat that, right, in your marketing, you can do a lot more public service announcement style work, a lot more community outreach work, a lot more podcasts, right? And you can reach this audience that needs to know this information. They're in need. Everyone's going to treatment locally now. That's been a big trend. They're not hopping on an airplane and risking infection. Desktop computers, everyone's on a desktop size screen more so than their mobile device lately because they're working remote, doing their research from home on a laptop. And so your communication methods need to update and change a little bit to reach your audience and make sure that they're hearing you, but they need your help more than ever. There are more people in need than ever. And then we've also seen certain trends continue as they always have. About 70% of all calls that you're going to receive at a treatment center are going to be the mother of your potential patient, not spouse, not significant other, the mother. So even, I'm 36 years old, probably my mommy would still call if I needed to go into treatment. And so think about these trends, but that's where things are going.
Yeah, that was mommy drove me to treatment. Mommy and daddy drove me to treatment, at 34. So I can certainly relate for that. I needed to make the call, but they took me. So, and you bring about a great point for me to ask you, and that is, I'm sort of a little bit of role play here, I guess.
Sure.
Dan, is I am mom, I am dad. I'm in front of that desktop. I got a son or daughter, whoever, in the throes of addiction. And what are some of the signs to look for when I'm sort of, being patient brokered? Like what I'm looking at a screen, Google can be confusing at points. There's a certain, my understanding of it, ads at the top that are paid for, and then there's the organic underneath, and then a little bit further on, I'm on the phone now with a rep. Maybe describe some things to look out for, educate the listener here to be aware of if they're seeking treatment.
Sure. And I would tell, all consumers to be wary of social reviews, but to check that there are social reviews, right? A real business would have some semblance, some volume of reviews on Google My Business, on Facebook. So just checking that they are there would often validate that it's a real company and patients have received care there. But, view that with a filter, because someone that maybe attended a certain treatment center and relapsed, they might leave a scathing review afterwards or blame that treatment center. So you're not always going to see positive reviews and sunshine and rainbows. What I would say is this: navigate the treatment center's website directly. When you call any number, no matter where you are researching, it should be answered with the treatment center's name. So, hello, this is Dan at ABC Treatment Center, right? There shouldn't be a helpline, right? Those kind of indicators would steer you in a path where you're potentially part of a media network. You're potentially being sold as a call or as a lead. You want to be interacting directly with the care provider. And it's okay if that's an admissions team member. A lot of the time they're, the most useful person in the company, right? And so get all of the information you need. This is part hospitality and part healthcare, right? Your loved one is going to go live there for a while in most cases. And so you want to know that, I joke about this a little bit, but pictures of beds and food on the website should match, the experience that someone has. And it doesn't need to be luxurious. It doesn't need to be, an amenity focused site. I would be wary of that. But simple, demonstration of respect, showing some comfort, alleviating some fear. That's the kind of content you should see in a real treatment center's website.
Well, that's wonderful. And that's very helpful to the listener out there. I know a lot of times it can be a very difficult experience to navigate. I know for myself, we did not have a lot of experience with that. It was my episode of treatment, luckily for me so far, and I hope it stays that way, was the one episode of care. And, we went to a local place but there's so many complexities today with it. And that's really helpful. I remember seeing a commercial with a quasi doctorish looking, maybe a nurse, and then they'll call this, help addiction helpline thing. And now that you're talking to me about it, I'm realizing that I don't think that's a particular place. It's one of these lines that talk, and I don't know if it,
but it makes sense, right? If you're at that point where like, I do need help, and that commercial comes on, you're going to call it. It makes sense. If you're looking to adopt a puppy and a puppy adoption commercial comes on, you're going to call it. Marketing does work. I will say this: it is difficult to manipulate or trick someone who's seeking treatment, right? That concept of you can't BS, someone who's got a master's in it.
Yeah.
You're dealing with a population of people that are at the peak of their manipulation skills. And so you don't need to trick them. You don't need to outmarket them. You can just say it like it is. They'll see through all the filters, all the BS, and you can just give them good advice. You can actually advocate. You can just say it in your content. You can actually say, we are here to help you get into treatment, whether it's with us or someone else, right? And you'll find it's not about honesty as much as just direct communication, right? Remove the jargon, say it like it is, and you'll make a meaningful connection. You're actually going to establish a more trustful connection with the prospective patient.
Wonderful. Well, there you have it, folks. Be straight when you're either providing treatment or seeking it out. These are just some of the steps that Dan has shared with us, and to ensure that when you're searching for a reliable treatment center, you can find one, whether it be one of ours at Amethyst Recovery Centers or otherwise. We are here to help. If you or a loved one are in need of help with substance abuse use or co-occurring mental health disorder, call Amethyst today at 855-80-SOBER or visit us online at amethystrecoverycenters.com. Thanks for being with us today on another episode of Share. I'm Kabir Singh, and we'll see you next time. Thanks.